The Aero OnControl powered bone lesion biopsy system is the first major advance in bone and bone marrow sampling procedures in more than 40 years, helping to effectively, safely, and quickly obtain high-quality specimens, even from dense and hard-to-reach bone. Using our patented handheld driver technology, practitioners can rapidly access difficult bone lesions and obtain high-quality specimens, especially with difficult-to-reach lesions. Prior to use, please see the instructions for use for a complete listing of the indications, contraindications, warnings, and precautions. After opening the product tray, place the non-sterile driver into the black connector in the sterile tray with the driver handle towards the orange needle hubs. Pull up the sterile sleeve over the driver with sterile, gloved hands, being careful not to touch the driver. Remove the white tab to expose adhesive film. Fold sleeve over to adhere and roll downwards towards driver. Fold the blue tabs inward to close the bag. Confirm proper anatomical landmarks. Diagnostic imaging guidance is recommended. Insert the needle manually through the patient's soft tissue to the desired cortical bone. Find location on bone and note depth marking. Attach the OnControl driver until an audible click is heard and squeeze trigger to activate driver. Do not apply excessive force to driver needle set. Squeeze trigger until bone access needle set has reached the desired location to be biopsied. Disconnect the driver from the needle by lifting up on the black collar on the connector and lifting the driver up and off the needle hub. If needed, use the manual handle for minor adjustments of the bone access needle set. Remove the clear handle by placing a thumb on the hub and pulling upwards and off of the needle set. Twist and lift the stylet from the needle set. Place the bone lesion biopsy needle inside the bone access cannula. Reattach power driver to bone lesion biopsy needle. Using centimeter marks on the needle as a guide, squeeze the driver trigger and advance the bone lesion biopsy needle to desired biopsy length. If in a sclerotic lesion, limit biopsy attempts to 0.5 centimeters as they may be difficult to remove from cannula. With the trigger still engaged, pull up on the power driver until bone lesion biopsy needle is completely removed from patient. Retract the black collar and remove the needle. Insert the bone lesion biopsy ejector rod into the hub of the bone lesion biopsy needle to push the sample out of the distal tip. These steps may be repeated if another biopsy from the same cortical penetration is needed. If extraction is difficult, use the ejector assist by sliding up the cannula to the hub and click into place. Then you may extract your core by pushing out of the distal tip. To remove the bone access cannula from the patient, reattach the power driver to the hub of the bone access cannula. When correctly attached, you will hear an audible click. Squeeze trigger and gently pull straight out of patient.